good evening and a very warm welcome to the EASL Studio tonight with your weekly hepatology broadcast news. In today's episode, we're going to be asking the question, are there enough liver nurses in Europe and can they do more? It's very timely that this discussion is coming out this week because on Friday the 12th of May is actually the International Nurses Day. It commemorates the birthday of Florence Nightingale, who was considered to be the founder of modern nursing. And this is a day that's celebrated by nurses around the world and has been since 1974, so a long time. So this is a good opportunity to celebrate and highlight the role that we can play. My name is Kate Jack and I work in a large university teaching hospital in Nottingham in the Midlands of the UK, and I work as a researcher and a hepatology nurse. And with me this evening I have Michelle, also from the UK, Patrizia from Switzerland, Núria from Barcelona and Denise from Austria. And I'll invite everyone to introduce themselves properly in turn. So Michelle, would you like to tell us a bit more about yourself?
Hi, good evening everyone. My name is Michelle Clayton. I'm a liver nurse educator from St James's Hospital in Leeds in the UK, which is a super-regional liver and transplant centre. I'm also the chair of the British Liver Nurses Association.
Thank you very much. And who's next? Patrizia?
Yes, good evening. My name is Patrizia Künzler. I'm a nurse from Switzerland. I have done my PhD and I work in part-time at the university where I'm doing research, also in hepatology. And on the other part, I work in a large tertiary hospital and I'm specialized for caring in patients with liver disease. And
Wonderful.
actually, sorry, I forgot, I'm the actual chair of the Nursing and Allied Health Professional Task Force from EASL. So very interested in the European perspective.
Absolutely. And Núria?
Good evening, everyone. My name is Núria Fabrellas. I'm a nurse from Barcelona. And I'm a professor at the University of Barcelona. And my main research is doing in the liver field.
Wonderful, thank you. And then finally, but not last really, is Denise from Austria. Please introduce yourself here.
Yeah, warmly welcome from Vienna. My name is Denise Schäfer. I'm working as a nurse in Linz in Upper Austria, specialized in patient education for patients with liver disease. And on the other hand, I'm working for a nursing network, especially for liver nursing, which is very in the baby shoes in Austria.
Oh, thank you. It's lovely to have a good group to have a chat this evening. But when we talk about liver nurses, what do we mean by that? Who is a liver nurse, and what gives you that title? So Denise, how does that just describe in Austria?
Unfortunately, we don't have an official definition of what liver nurses are, but typically liver nurse refers to nurses who work specialized in wards or units that focused on liver disease, that may also work in non-specialist hospitals, but have a particular interest and expertise in liver disease. And they may also include nursing working in advanced practice roles, such as nurse practitioners or clinical nurse specialists.
Ah, so quite a variety. And so Núria, how does that compare to your experience in Barcelona?
In Barcelona, it seems Austria. People who work in the hospital, in the wards, the liver wards, they are not specialists. They know a lot how to treat liver diseases, but they are not specialists. Nevertheless, right now it starts a lot working with advanced practitioner nurse. Advanced practitioner nurse is not defined yet as an organization or as a country, but a lot of hospitals has practitioner nurse, that this practitioner nurse has to have a master degree and to know a lot about liver diseases and to work in a liver unit for at least 5 years or more. That's
Okay.
at that moment what happened in Barcelona, because in Spain it's different. I think it's in my country it's different in each hospital. Each hospital is different from another hospital because there is not any framework.
Oh, okay, quite different. Michelle, would you be able to fill everybody in on the English perspective of what happens?
Well, I think obviously we can have a small district general hospital, we can have a sort of tertiary type liver unit, also the large district general hospitals, and then we have very specialist care for the transplant centres with 7 units across the UK. But I will pick up on what Denise was saying, where she says that obviously you can have nurses that are interested that maybe don't work specifically in a liver area. So a good example, I think, is gastroenterology nurses who actually have, can have that sort of interest in caring for people with liver disease. And I think it's really important that, our net is wide and not just looking purely at advanced practice. We know very much that there is a lot of work with people with liver disease that goes on in non-liver wards. So I think we just have to bear that in mind as well.
Absolutely. And how can we increase interest in liver care amongst nurses in non-specialist wards? Does anyone have any thoughts? Yeah.
May I jump in?
Yes.
I would say, so Switzerland is probably quite similar to Barcelona. We have gastroenterology wards in the hospitals, and there we have very interested nurses in liver care. What my experience is, I work in an advanced practice nurse role, my colleague as well, and we have doing some research, and we have now the experience what happens when we translate these research findings into clinical practice. And here we can really see how the nurses on the wards are interested, how they grow with us, and how often I have now discussion about what can we do there and why we are doing this. And so I think there is a big motivation, a great motivation behind when they can see how we approach and how nurses can have an impact as well. So there I can really see how it changes and how especially research translation in evidence-based care is supportive for the nurses growing.
Very much so. And a few people have mentioned already this evening about the concept of advanced practice. So I don't know who wants to chip in first, but tell me, what does advanced practice mean in your country, and how does that differ from the fundamental care that all nurses can give?
Probably I can go on. So in Switzerland, advanced practice nurses have at least a master's or degree or a PhD, and they work in a clinical field and are specialized in. On the wards, we have all nurses with a huge grade and skill mix. But an advanced practice nurse is not a protected professional title, but we are working on this, and these are the clear requirements here.
Okay. And is that the same in other countries where all nurses in advanced practice have to have a master's degree?
May I jump in Austria, it's the same situation like in Swiss. We have at the university the master, you can make your master degree in advanced nursing practice, but it's not defined by law. which we're working on strictly hard. But we define advanced nursing practice at the Hemrick model, the framework for APNs in Austria. This is the role we see when we're thinking about advanced nursing practice in Austria.
Okay.
And in Spain, it
Yeah.
happened the same. It depends on the hospital. But right now, there is a kind of a group who is working about the advanced practitioner nurse, and they recommended to have the master degree, the minimum level, and for us, the ICN recommended that all the advanced practitioner nurse has to have a master degree. But it depends on the hospital. In some hospitals, you can find one advanced practitioner nurse without any master degree. Right now, we try to regulate this position, and well, at least in our country, the advanced practitioner nurse is one who has acquired expert knowledge about liver disease, in that case, of course, and they can take a complex decision, and they can perform a complex skills too.
And Michelle, how is it in the UK?
So obviously it's very similar in terms of level of required education, so masters and above. I think as well that it's important to say that, again, we do not have any national legislation, and I think this is something that when you talk about a protected title, I'm not sure that we will ever get to that within the UK as such. I think there's always variance across any country, and that is very much down to each hospital trust. And we do see that nurses do different roles across different hospitals. So I think it can be quite varied. I think what we have to think about is what is defining advanced practice within our own hospitals. Is it because actually nurses are at the pinnacle of care and excellence and quality, or are there underlying more sort of fundamental aspects of the particular hospital? Because in the UK, for example, we've seen reduction in junior doctor hours, which has created more advanced practice roles within nursing, but not necessarily for the right reasons. So, and I think that we have to bear that in mind in terms of it's very good to have advancement in nursing practice, but is it purely for nursing advancement, or are there other agendas?
That's a really important question, isn't it, for a big discussion? What does everybody else think from different countries? What has driven the need for advanced practice? Denise, how about in Austria?
What we see is we have patients which getting a diagnosis, which getting medication, and they learn a lot about it, but not how to live with it. And I think advanced nursing practice is much more than most of the people think, right? We have expert coaching and guidance, and also, may provide expert coaching and guidance to patients and families and other healthcare professionals. And I think this is also a big part we have to think about it. And also to develop the clinical practice of nursing, because all nurses develop with advanced nursing practice, not only the APNs. And last but not least, it's about leadership, because in Austria, we have so many health professionals, and it's working side by side, but not together. And APNs are like in Austria we call it the red Faden, roter Faden.
The red thread.
Yeah.
The glue. Yeah.
Which connects all the health professionals and in being a key role for all roles.
So we've talked a little bit about advanced practice, but what type of activity do advanced practice nurses do? What particular skills or knowledge are we seeing? Núria, what does that look like in Barcelona?
Well, here in Barcelona, they follow up chronic liver disease, provide care to the families, coordinate the different providers or different healthcare professionals. They promote health lifestyles, and they need to do, I think that they have what's the name? They need to be a leadership in the care of the patient with a liver disease. They need to do a research, of course, and they need to be in touch with the patient, and usually no, that's it's commanded to give an integrated care, not just solve one point. They need to work with a vision, with an integrated care vision.
It sounds like it's a very joined up role that brings together everyone that the patient needs. So do you have many nurses that would see patients in an outpatient clinic situation and review their health in the way that a doctor might have done in previous years? Yeah.
In Spain, we have, I think that the nurses right now, the APN are increasing, because it starts with just one or two per service, and right now per unit, and right now there are more. In some units there are 3, in another one could be 5. It depends of the unit, and I don't know, I suppose that it depends of the necessities of that service, and it depends of the nurses, because some nurses they don't want to act as APN, because sometimes there is so many responsibility, and some nurses said, I don't want this responsibility. I'm okay with my I don't know, my manner or my
with the current level of practice.
With the cover level, with the basics. And, you know, but right now the APN are increasing in all the hospitals and in all the units.
One element of nursing practice that has expanded in the UK, and that was certainly really in recognition of the reduction of junior doctors, was the ability of nurses to prescribe medication and undertake a specific training course as a non-medical prescriber. But I don't think that happens widely across Europe, does it? How? Tell me about your countries and the abilities of prescribing.
In Spain, we have a catalog for all the nurses, and we can prescribe some medication. Some another we cannot prescribe, but some medications it's allowed for the nurses to prescribe. And of course, we can modify. We can increase or decrease the medication. But not all the medication, just some, we have a catalog with different medication.
So would you be able to prescribe particularly, for example, spironolactone if somebody had ascites, or is it more about more simple prescribing for patients who are on wards, like if they need some paracetamol or an antiemetic?
Let me say that more basic medication. With the diuretic, we can move, we can increase or decrease, but we cannot prescribe as the first option.
Okay. And Patrizia, what does nurse prescribing look like in Switzerland?
That's a difficult question. So we have one region who has started now with this prescribing, but I would say at the moment, most of Switzerland nurses are not allowed to prescribe. So we are there sometimes, also with blood tests and so on. It's like a little bit a gray zone we know very much about, and we know what we have to do, but at the end we always need a doctor behind who will sign and takes the responsibility.
Okay.
And probably just to mention it, so I know also, as we have written an article in the Journal of Hepatology, there is always a little bit the connection. What is the medical role of the nurse and the advanced practice nurse? And I really have to say how we live it in Switzerland. So with all the law and the financing, there is not really this medical role and tasks in, but we are like in Austria and Barcelona, they told us the nurse is here for the patient and the caregivers, how it is to live with a chronic disease, how it is to be ill, how they can self-manage. We are doing case coordination, and it's all about these tasks we give in taking care of these patients, and not so much a substitution of medical doctors.
It's interesting, isn't it? Because I think in the UK, I'll ask Michelle what you think as well, but the nurses do seem to have taken on quite much more of a medicalized role with prescribing and, for example, doing fibroscans and even paracentesis. So, Michelle, as a lecturer, how do you see things changing in the UK?
I think it's really difficult because I think we have great opportunity to evolve roles for nurses. However, it needs to be around what is a benefit for the patient. So something like nurse-led paracentesis has been a great benefit for the patient experience, for supportive family, etc. And that's been really well received. I would say quite a lot of hospitals, certainly anywhere that's got at least a large district general or tertiary liver unit and above, will probably have nurse-led paracentesis now. And that has been shown that patient experience is much better, so your patient outcomes are much better, and also you save bed days as well, because that tends to be done in a day case sort of provision. I think what we have to be careful though is, and what we've seen is this nurses nearly becoming mini doctors. And that's where actually I would prefer to see nurses very much really focusing on being experts in care and being role models to others, because if we are going to take experienced nurses into these roles, then we want to be able to benefit still from their experience. And I feel very much that the nursing and the nursing care aspects become much more secondary to a more sort of medicalized model.
Different changes.
In Spain, the advanced practitioner nurse, it doesn't want to substitute the physician. For example, for us, here in Spain, we can do the fibroscans, but we are not allowed to do the paracentesis. And at that moment, they are more nurses than physician assistant, because they are advanced practitioner nurse, and all of them want to be nurses, not at least a lot of them.
And I think that's really interesting, because one thing you say there is that obviously nurses are involved in fibroscans, but in many hospitals in the UK, unregistered practitioners are taught how to do the actual process of the fibroscan, but really it's more about the interpretation of the fibroscan, which would fit very nicely within the registered nurse sphere of practice. So I think it's really interesting to hear these different roles, but you know, I applaud Spain in terms of that you want to work at your nursing and not necessarily become medicalized, because that's what I think is at risk within the UK.
And
yeah,
I don't know if you if you don't understand me, but fibroscan is in Spain is done by the registered nurse or the advanced practitioner nurse, but the registered nurse performs the fibroscan.
and I think, I mean, I've worked in clinics where I have done a fibroscan, and it provides a really good opportunity to then lead into a conversation about health promotion and lifestyle advice and give the patient the results, and it all works very well together in that. So in the last few minutes, I just wonder if we've got time to talk a little bit about the kind of education that might be needed, and would there be scope, does everyone think, for some European guidelines or some European advice for what constitutes a good level of education, or specific details for nurses interested in liver care? Is it something that we could do, or are there too many differences in the different, you know, between countries for that to be a workable?
I think there are certain themes within liver in its widest form that would translate across many different countries, such as things such as pathophysiology. You know, the pathophysiology of ascites is the same in England as it is anywhere else. So I think that there are certainly areas, what maybe it's about the broader brushstrokes and maybe setting the foundation of the education, and then that can be utilised by an individual country who could then maybe build in their own requirements depending on country specific area that might have different aspects to consider.
So, for example, if there were any different specific medicalized skills that a nurse would take on, they can then have training that's then been built on that core understanding of anatomy, physiology, pharmacology, and any sociology that's related to this. Liver disease is often underpinned by addiction, so a good understanding of the psychology of addiction and how nurses can support that.
I mean, I think also what we will find is around health inequality and social deprivation as well, and that sort of recognition of those risk factors for liver disease would be, you know, a really strong theme across any country. It sort of transcends an individual country, because we see, I mean, EASL put out their publication about liver care and the amount of sort of impact of social deprivation and health inequality. I think that came out last year, didn't it? So I think there's definitely broad themes that would be applicable
in different countries. And so does everyone else think that that would be a way forward, that perhaps that's something we could work on as a team and work on within EASL as a task force to promote liver nursing across Europe and give other nurses the opportunity to have some different education and some different strength with it? I think we're probably coming to a close now for our time for half an hour. Are there any other burning considerations that the panel here would like to be able to chip in and explain?
May I? I would like to say in the same way as Michelle that I believe that the scientific societies, as EASL, should play a role to design a framework for APN nursing for nursing education. Everyone knows that nursing is a dynamic with change to education, regulation, and whatever. But I think that the societies, the scientific societies, need to give an answer to for the healthcare, for the better, to increase the quality of the healthcare. So, in my opinion, I think that the EASL has a lot of work to do. We've got the lines and to create common frameworks or different strategies. Well, it's a lot. It's my opinion. Just is an opinion.
Absolutely. So I think we have to call it to a close now, and I'd like to thank everyone for joining me this evening and being able to have a chat about the strong role of nurses in liver care in Europe. In the next episode, the teams will be discussing the treatment of hepatitis Delta virus. So do come and be a member and join the EASL family, and tune into the next series of EASL Studios. Thank you very much.
Thank you.
Thank you.
Thank you.
Thank you.